नंबर व्हाट्सएप कर दिया और आप अभी तो ऐसे चलाओ से मेरे पास ऐसे है नहीं एक्सेस ना मेरे
Shall we start?
Yes, ma'am, we can start now. Okay, so
Good
very good
afternoon, everyone.
afternoon to,
Good afternoon. Good
yes,
afternoon,
ma'am.
sir.
Okay, ma'am.
A very happy Doctor's Day to you and everyone or future healthcare professionals. Our today's speaker is Dr. Vikas Patel, sir. Currently, he is senior resident at Sri Mahendra Hospital, Dehradun. Sir has done his MD in PMR from AIMS Bhubaneswar and he has done his MBBS from AIMS Rishikesh. He has also worked in pioneer institutes like AIMS Bhubaneswar and Reliance Foundation. We are very blessed with your presence, sir. I hope your lecture is going to increase the knowledge and a good motivation in our students. Sir, you can start your lecture, sir. Welcome, sir.
Okay, thank you very much, ma'am, for the kind introduction. And I will try my best to enlighten you all the aspiring doctors who are in the line, and they are going to join the job very soon, or they will be in the line very soon. So, good afternoon, my esteemed colleagues and all the students. I'm wishing again you a very special National Doctors Day. Actually, the Doctors Day is happening is on every year on the 30th of March, as it was the first day when we use anesthesia for the surgical procedures. But in India, we are celebrating this Doctors Day, or we called it National Doctors Day, on the 1st of July. So today we will celebrate not just the white coat you are going to wear, but the all the dedication and all the hard work which is flowing in any of the hospital which is done by you. As being a doctor is not just a job, it's a basically a calling from yourself. When you decide, you are not just opting for a job, you are becoming a more responsible citizen also. So I hope in the short lecture in this webinar, I will try to give you some insight in the profession and how to be a good doctor. That is the need of the current time. So let's start. Chaitanya ji, you can count on slides. Okay, so this is just an introductory thing that the day we are celebrating today is in the honor of Dr. Bidhan Chandra Roy. He was a definitely very passionate and very dedicated person in his life, in his profession also. And he was the first person in the Indian history who was politically also very well oriented. And he was two times of chief minister for the West Bengal. So this person who born on the July 1st and died also on the July 1st. So in the memory of this person, we are celebrating every day, every year, this 1st of July as a National Doctors Day. And still in the Indian scenario of medicine, the BC Roy Award is the most prestigious award in the medical community. So you can play next. One of the his inspiratory thing, whatever he used to teach his students, that whatever your hand find to do it with full might or full power, because the key to excellence, as we all have been learning since the childhood and in the moral science stories and all those things, that whatever you are doing, do with the full might, full passion, full dedication, then only you will get some good result. So as I said, that being a doctor is just not a job; it is a calling, a dedication that that flow through your veins and in through walls of the hospital. Also, it takes a very unique blend of intelligence and also compassion, some very determinative behavior for the studying, for tolerating very different kind of patients. And also we spend so many years of time for accumulating the knowledge for this the human body, that is very integrate kind of biological system. And also the whatever is the latest medical advantages advancement we are experiencing in terms of technology. So basically, the role of a doctor is very vast. We cannot just go through some books and just become a doctor. You have to be a good human being first. Then you have to be technically sound. You have to be thorough in your knowledge. Then only you can become a good doctor. Chaitanya, you can play the next slide. So I will be keeping. So in today's lecture, or we can say this webinar, my focus will be that I can say some, I can share some of my stories, some of my experience with you, so that you will be having some help that how to become a good doctor, what is a good doctor. Now in today's time, whenever we are feeling that our relative or ourselves, we have to take some appointment with a doctor, we search for Google, and in what so we see the review of a doctor, that how good he is, what other people are been saying about him. So becoming a good doctor is the very need of this time. So he is William Osler. He was one of the very initial day of initial physicians who just describe that the physiology of the body, how it works with and without medicine. So he very strongly hold his thought about medicines, that do not prescribe medicine unless it is very needful, or it is very necessary for the patient. So he just said that one of the first duties of physician is to educate the people when not to take medicine. Basically, he emphasized on the fact that we should educate our patient about their disease, not just prescribing the medications, not just prescribing the treatments, or writing for you, you will go for this surgery, then only you will be better. So educating the patient is a very well needed demand in this job. So, a role of a doctor, as we all know, doctors are not just a 9 to 5 job kind of person, that they do one job, they treat patients. They wear many hats. They have to behave like scientists. They have to analyze in very depth the situation, the symptoms, the sign of the patient, so that they can diagnose very well. uh, Basically, you can compare them with the Sherlock Holmes, just like a very good detective. By seeing the clues and finding the things, and just relating and then correlating all those things, and making a bigger picture, so that you have to understand this, that a role of a doctor is not just limited by the knowledge of his books or his skill in the surgery. You have to think like a scientist, you have to act like a detective, you have to see very minimal or very subtle cues which can direct you for a better diagnosis, or you can just rule out the very so many of diseases you can just rule out with just at the looking at the patient. No need for any hi-fi test and MRIs and blood test, all those things. So and also this education, this medical field is growing just because of previous doctors are educating to the coming young ones. So they are educator, they are scientists, they are the detectives. They are explaining complex thing in simple word to the patients, also in their in a layman language. So you can say that doctors are first a very good person. They have good communication skills. They are kind of a detective. They also know how to put the pieces together to solve the puzzle. And they are also scientists. They are the one who are discovering, who are searching, who are researching again, and they are putting the evidences, which treatment is the better, which is the best one, which will be the beneficial for the patient, which intervention is of no use. So there are several roles to the doctor, and Chetan, you can play the next one. So you have to be of this kind of personality, where you can you should be ready for reading for several hours. You have to be ready for using your presence of mind every time. So basically we can say that if categorizing with the adjectives, so we can say that doctor should be dedicated, he should be very observant, he should be compassionate and thorough in his knowledge, and all those things will be well organized. Organizing things, organizing your all known things or your data, whatever you have collected in your mind, that is a crucial thing. So for being a good doctor, you have to develop these skills, or say just practice these skills, and you will be a good doctor. So I know from some stories that you can just go back to previous slide, Chetan. I will tell you. So here are some stories which I faces in 2 3 places where I have worked. So one lady came to the OPD crying, and she came in the emergency OPD. So she was very tearful and was crying aloud, and she was having some swelling or redness in her foot. So on examination, yeah, when she first visited our OPD, someone gave her a dose of paracetamol and some diclofenac, so the pain will be resided. Another, after 1 or 2 months back, she came again, and this time luckily someone put his hand on her foot, and just then what he noticed, that she was applying a cosmetics, or you can say the makeup thing, to look the leg swelling like it is swollen or due to some disease. So it was just a attention gaining behavior of that lady. So if you don't touch your patient, if you are not dedicated to that patient, or you are not enough observant to the patient, you will miss the disease. See, after that, when we rub the makeup with the cotton and showed to the her parents and her fiance, then never again she came to our OPD. Maybe she will be fooling some other doctors with the same trick, but not in our OPD. Another incident, when a lady came to our OPD, she was very kind of her parents told that she is unconscious from last 2 hours. So we prick her wrist, we draw the ABG sample, we did some medication also, but all those pricks she did not respond at all. She was very quietly suffering. She was very quietly suffering with these pricks. But when we try to insert a nasogastric tube through her nose, then suddenly she woke up, and she said it was just all a drama to convince her parents for some personal things. So being observant and thorough with your knowledge, and also dedicated. Suppose if you are not listening to the patient carefully, you are not touching the patient, not touching in a sense, just in the examination, the palpation, and these findings, you should be dedicated, because in most of the time when we miss the examination thing, is the part when we are feeling tired. We are just letting the patient getting the OPD finished, and just like finishing the patient, we have to finish by this time or that time. So dedication is must. Without dedication, you won't feel like being some observant or compassionate or thorough through your knowledge. You will not allow your mind to speak, or you will not allow your mind to think in a categorical way, think in a analytical manner, so that you can diagnose what is the reason behind this presentation. So basically, the road to becoming a doctor is not at all easy. It requires some sacrifices, some very relentless discipline and courage to face these constant challenges. But at the opposite side, the rewards are also immeasurable. The look of relief that patient will give you after successful diagnosis or treatment, and the joy you can witness from their relatives or patient itself, that will give you immense pleasure to you. And most of that money is also the part, and also the satisfaction by the work. So these things you have to feel in your OPD, in your day-to-day practice, but for these you have to be dedicated, observant, and bit of organized. Discipline is the key for all those things. And today in this scenario, moreover, most of the doctors are treated like a some people also call bluntly them dacoits also, that they are charging, they are looting our money, they are writing uh, different kind of test for just for the sake of money. But that is not right at all. We sometimes we need so many things, to so many of the clues to gather the large amount of data, so that we can analyze and we can go through what are the other possibilities which can be manifestation of this condition. So just you can celebrate this or you can suffer with this, that you have to be dedicated, you have to be very disciplined, uh, so that then only you will be able to use your intellect, your dedication for getting these kind of job satisfaction. The next, Chetanji, please, the next slide. So I just already told that they are doctors, and we are not just treating illnesses. We are also healing hearts and mind, and this will you only feel when you are getting satisfaction in terms of patient review, or in terms of the when you will see that patient is thanking you after getting some treatment or medication or anything, whatever you do, even a simple counseling for that these symptoms are not very dangerous, the things will be suffice by itself. These kind of counseling even can help these patient, that these the words, the healing of heart and minds, this you will definitely experience when you are talking to your patient, when you will listen them carefully, and you will dedicate yourself for the white coat you are wearing. So I just we have to understand that we are more than a healer. We also heal the minds of people or spirit. Basically, when you tell someone what is the disease condition, the background tension of their background tension related to the disease, at least you can totally ameliorate from their life or their situation. So they will be focusing more towards their work or their family. So basically, we are treating body, mind, spirit, everything. So we have to act like this. Okay, next slide. So these qualities of a good doctor or the healer's touch, we say, of course, we have to gain a thorough knowledge. Knowledge comes only from reading, writing, or something experiencing in the OPD. So we have to be thorough with our knowledge. Uh, Master for mastering the art of diagnosis, you have to be thorough with the knowledge. So many units of data in your mind, and then only you will be able to analyze it. If no data in the mind, then you will not be able to analyze it also, because you have nothing in your mind. So reading the books, observing the patients in the OPD, both are equally important. Today so many people are learning just by observing or seeing the things, that how these things are being doing, and what treatment is written on the paper by some other doctor. Just don't follow that. You have to be for making yourself a good doctor, so that you don't repeat the mistake of others. You have to be you have to be thorough in your knowledge, in your practicality. For being that, you must read books, you must invest your time with the people in the OPD, with your teacher, so that you can learn the skills. These observational skills are very good, but they can sometimes they can lead to some errors also. So for correcting that, you need to you need to be smart in your day-to-day activity, by learning with the crucial things, and by memorizing the facts, uh, rectification, most of the people will say that this is not good, I don't like, but you have to mug up things. This is the only thing that will make your brain more heavier and more loaded with the data. If so many points to think out, then only you can make a good diagnosis, or you can make something different from others. So being a good doctor, I will only say that you have to learn a lot. You have to mug up few things. You have to perform these tests in the OPD, in the on the patient itself, so that you just learn, not only learn from the book, but also you take it into the practicals also. Then only you will be able to detect. Then only you will be able to be different from those people who have already written, or they have missed the diagnosis, they have changed the things, which change the line of management or treatment that is not required. Okay, next slide, please. Hello, am I audible? Hello, Chaitanya ji.
Yes, sir. Yes, sir. You are audible, sir.
Okay, 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 okay. So this medicine, or this our profession is much more beyond the science. It also need empathy and compassion, good communication and clarity in your thoughts, in the way you communicate with the patient. It should be very clear, should not confuse the patient more, or just clear the question of the patient. And patience is the key for all those things. If you are not patient, if you have some worry, if you are thinking that you have to finish the OPD by this time, or this is the problem other than the OPD which you have to face, then the patience will not be there. The worry will reduce your patience level. And when you are not having some patience, then definitely your understanding, your empathy, and your communication skills all will be go down with this. So these few things which I will say, empathy and compassion, are very necessary when we ask a patient his story or his symptoms, his duration. Then the sense of care also heals the patient, that this person or this doctor is at least caring for my disease, just not writing some prescription, or not some writing just only few medicines or treatment, not writing only just some test to look out for further in follow-up visit. Empathy and compassion, whenever you will give to any person, whether it is a medical related thing or in a personal life thing, you will get some very good results. Okay, next. I already told that the key to these things is the patience, to be in peace of mind whenever you are in the OPD, or in the lectures, or in your private practice, or whatever setting you are having your work, or doing this medicine related practice. The uh, patience is the key. If you are not patient enough, then just close the setup, leave the place. Otherwise you will be doing harm to yourself and your patient also. So any number of patient you must be seeing, at least all, you are very young and you must be seeing 50 to 100 patients per day. You must be visiting so many patients every day. But for every patient, you are the first one to whom he is or she is visiting. But s- uh, but you are already tired. So it is like it may be the nth number of patient for you, but for that you are the first one to whom he will be talking or she will be talking. So you have to listen him carefully. Be just your patience level you have to increase. Then you will see the very good results very immediate from just that visit, or from next visit you will be seeing that just increasing a bit of patience level will increase your output very drastically. Okay, change the slide. So currently, if I say there was a time when doctors were called as a god or something, just next to the god, but in today's time, we are all a customer and a service provider relationship. The day when doctors were included in the this consumer court forum, the day still declares that we are also a shopkeeper, and the patient or the person coming to your OPD is a customer. So customer, this line whichever I have written here is was told by Mohandas Karamchand Gandhi or Mahatma Gandhi. He told that a customer is a most important visitor on our premises. He is not dependent on us. We are dependent. So this is the current scenario. We are dependent on them for money. They are not dependent. They have so many options, but we are dependent on them to serve them, to heal them. So just this line also explains a lot what is happening in today's scenario, that customer is most important visitor uh, to our premises, and he is not dependent on us, and we are not doing him any favor. That if we are treating him very well, you are doing all those hard work, you may be thinking that I am working very tirelessly or some dedicated work for this patient, but that is not the scenario here. We are not doing him any favor by serving him. He is doing a favor on us by giving this opportunity. So you have to keep this thing also in mind, that the scenario has been changed, and no one today you will recognize as you are a next to god or something like that. You have to be very and all in all those scenarios, the being a good doctor is the always key to success. Good doctor means you have to be very observant, very thorough in your knowledge. You have to think like a detective. So many malicious false cases of low back pain just to gain some leave from office or some personal gain or social gain. You must have experienced these things in your day-to-day practice also. So being a good doctor involves these things to handle in a very professional manner. Okay, next. And this is the thing I will like to request all my juniors and colleagues, that in our OPD, we usually give more attention. Suppose someone said that this is the patient this is the patient of relative of the MS of the hospital, or some minister of the state or something like that, then only we are paying attention, or then we only greeting that patient very well. And that should not be the case. So best is to give some compassion to everyone whoever is coming to your OPD, and especially to those who are poor, because they lack something called as confident communication with them. They think that you are a different, you are some superior to them, you are something, you are sitting in a very different position, so they cannot ask simple thing. Many times they even do not explain their symptoms properly. So all those who belongs to those called as less privileged community, you have to give some extra effort for these kind of patient, just by being greeting them politely or asking them politely, and asking them multiple times whatever you want to hear. uh, this much only do the most of the work, because and this is necessary, because if he will not be explaining his symptoms or his difficulties to you, then you will not be able to give him proper solution. So this is my request to all those, that do not fall in this VIP only. Then we will ask politely, or we will greet them with a smile. Just um, go with this new thing, that whenever you find a patient who is less privileged class or something, any disability or anything that is hampering uh, them to talk to you comfortably or anything, then just be extra polite and give some, you can give some out of the way help them also. Okay, next. So sometime this is another thing I will like that you can follow in your practices in your day-to-day learning also, that some things are very subtle or very mundane for you, but these can be very important. Uh, Diet and exercise, these thing. Uh, Whatever they told you that I feel this problem much when I eat this kind of thing. There are so many patients, they will tell that जब मैं ये खा लेता हूँ तो इसके बाद मेरी ये problem बढ़ जाती है. You can simply think that then don't eat those things, just avoid them from your diet, but you have to respect their their way of life. So give them the education that if you know about those particular foods that they are harmful, like what is the harmful component of them, what is the way they can harm in your body, but uh, never make fun of these things. And when these times, sometime people will say that I am taking this other pathy for the medication and it was very helpful, then most of the time we will feel that a impulse to say that, then just continue those pathy or those things. But there may be some misconception, there may be some lagging thing which will be corrected by your way of treatment. So always respect other systems also, and do not be very derisive that other systems are not uh, going to help in these kind of in these kind of diseases or the situation. So you can give space to all those things, whatever the patient tell you that their dietary behavior, their exercise behavior, their fondness to a particular of pathy. You have to give the space, you have to give the respect. Okay, next. So the future is medicine is bright also and complex also, because the use of more and more artificial intelligence and technological advances, and the quality of research is just being improved with this thing. So you have to update yourself also. Just enroll in some artificial intelligence learning thing, or how to use these mathematical tools or some digital tools in your practice. You have to also go with this thing. This is a just beginning of the era. In next 10 year or 5 year, the situation will be very much changed, so you have to be updated about this also. So I will not take much of your time. Chetan, you can go to the next slide and we will finish. As on the this Doctor's Day, I express my uh, gratitude to all, to your tireless services which you have been providing from very last time, very from this so much of time. So we can celebrate our dedication by ourselves, by doing some favor to on by doing some favor to ourselves, by taking care of ourselves, because nobody else, no one else will be taking care for doctors, so we have to take care of ourselves. Oh, and Chetan, you can change the slide. This is also okay. You can go to the next. So we have to show some appreciation also. So what is the appreciation? How can we pat our back by ourselves? That is not the case. We have to take care of ourselves, whether be it a medical legal situation, whether be in the knowledge update, whether be in the research update, whether be in the technological advances. We have to take care of ourselves. And by a common person like your mother and father, or any common person, how he can appreciate us, what work we are doing, the hard work we are uh, putting here. They can just follow our advices, any medical advices whichever are given by any medical practitioner or any qualified person. They should follow, and we should also follow, because the most of the time we the doctors are the one who do not follow any dietary routine or any exercise routine. We are keep telling to the patient, but we do not follow most of the time. So this is the only way to celebrate or appreciate our colleagues and our community, that we have to take care of ourselves. uh, we have to follow the medical advices. You can also say to your patient that they can do some favor on you, that just by following medical advices and accepting some healthy lifestyle option, and whatever thing they are feeling, they can discuss with you. So that is the end of my talk. I am very thankful that you all have given your prestigious time and are listening to me. This is my message, that for becoming a good doctor, uh, uh, it is a thing to say that we are called as heroes, but that is not in the reality. We have to take care of ourselves. We have to be more considerate in advancing our knowledge and be compassionate whenever we are doing some OPD work or anything related to patient care. Okay, thank you very much. Thank you, ma'am, and Chaitanya sir, for giving me this opportunity to talk to you. And you can also ask some question if you have something. Otherwise, we can just finish this thing for you. Okay, thank you very much.
So thank you so much, sir. Sir, actually, the students are not able to ask the question because they have not given the direct
Okay,
link.
fine.
So I just want
Okay,
to,
fine. That is a different thing. They should
sir,
enjoy their time. I have taken enough, so they can.
sir, I would like to thank you again for giving such a precious time to us and from your busy schedule. And it was always very knowledgeable talking to you as a colleague and as a now as a mentor also. And
Thank
also
you,
want to
Chetan.
thank
Thank you very much.
I also want to thank our HOD, Dr. Deepthi Bariko, and our fellow faculty members who supported us in every event we organizes for our student. I also wants to thank the management of Dolphin Institute, Dolphin PG Institute, for organizing this webinar, and special thanks to the IT department for their unconditional supports and organizing this webinar and supporting staff, and very special thanks to the students for listening sir, and giving your precious time. Thank you so much, sir. Thank you, Vikas sir, again. Thank you so much, sir.
Thank you, Chetan, and thank you, the institute and HOD man. Have a nice day. Okay, bye. Should I leave this?
Sure, sir. Sure, sir. You can.
Okay, okay. Thank you very much. Have a great day. Bye.
Same to you, sir.